Brings this crash cart, and my worst fears are realized. There's an IV set there. Now, how many of you have ever seen the doctor put in your IV? Like ever? I'm serious. Listen, I'm just being honest. How many peripheral IVs do you think I put in? Not that many. There's no central line kit. There's no ultrasound. I can use that. Intraosseous, give me the drill. I'll put it in your bone, no problem. But that's not what we do. And so I took this IV kit and I'm like, well, what do the nurses do? They kind of run the fluid through, kind of tap the bubbles out and all this other stuff. I kind of tried to remember what I saw them do. And I was like, they usually go for the antecubital. I can't really feel anything. There's no veins there. And I'm like, but I know the vein is there anatomically. It's like right near the biceps ligament there. And I'm like, well, that might be the vein. I'm not sure. Maybe. Tourniquet, let me try that. Doesn't really help much. Slapping the antecubital fossa, doesn't really help much. And this poor stewardess is trying to hold her arm down. And I'm like, I don't think I'm going to get this. So I pray out loud and I say, Lord Jesus, help me to get the IV on the first try. And I did. I actually did. And I gave this lady, she was vomiting on herself too. So the first thing I did was I put her on her side because I didn't want her to aspirate. So she's vomiting on me now. So basically, I put in the IV, and then I go to find, anyone ever heard of Ativan, Valium, any benzodiazepine, Librium? My professor from Stanford, he said, give me Librium or give me meth. That's what the majority of your patients are going to ask you for. So either alcohol withdrawal or drug abuse. They didn't all say that. They were kind of cynical back then in residency. So I looked in the kit, no benzodiazepine. She's seizing. What am I going to do? What would you do? I gave her something for vomiting. I could do that, right? I didn't want her to keep vomiting. So what do you suppose I was inspired to do at that point? I already prayed. But yes, I could have prayed again. I'm sorry. I apologize. I did not pray twice. I'm sorry. That's interesting. That's a good thought. At this point, someone else arrived, and I said, hi, Riesenberger, how are you doing? He's like, what specialty are you? I said, I'm emergency medicine. He's like, I'm sitting down. And I'm like, why are you sitting down? He's like, I'm an orthopedic surgeon. I haven't taken a blood pressure since medical school. And I'm like, well, you got to help me go through her stuff. He's like, that's her stuff. And I'm like, I don't have any history here. I need some help. He's like, if she dislocates her shoulder during the seizure, I'll put it back in for you, okay? Let's make that deal. I said, you're not going to sit down. I said, look through her stuff. So he looked through her stuff, and he found a glucometer. And I'm like, check her sugar. He's like, I don't know how to use this thing. I'm like, read the instructions. So he checks it, and it's 144. So what do you think? Do you think she's seizing because of the sugar? What do you think? Is that low, high? What is it? Yeah. But is it super high? Oh. Huh? Well, it's interesting is at that point, I didn't pray, but the Spirit told me, don't believe it. So I started to examine her, and I found this little lump in her abdomen. Do you know what that lump was? It was a pump. So I reached into her pocket, right? And I pulled out the actual controller and the computer, and it said her sugar was 8. Think that's low? Yeah, so I gave her an Ampa D50, and she went, then I gave her another Ampa D50, and she started talking. I gave her some orange juice, I gave her some jam, and she started walking. And I found out that she was type 1 diabetic, also smoker, too. Not a good combo, right? And I told them to land at the nearest port, so they went to Taiwan. And the medics met us there. She's like, who are these people? I said, they're the medics. She's like, I don't need medics. I said, you need an evaluation. She's like, that's my choice. Right? My sugar's low all the time. I'm like, when's the last time it was 8? And you had a seizure. She's like, oh, never. And I'm like, And she looked at me and she said, will you butt out? I'm not kidding you. As truly as I'm standing before you today, she said that. And I looked at the flight agent. I said, as a physician, I do not recommend this passenger board their connecting flight without a full evaluation in Hong Kong. And she's like, you can't do that. I'm like, I just did. And I said, ma'am, you're right. It is your choice. You can choose to wait in the airport because no carrier will take you with that kind of thing that just happened to you. Or you can go to the ER. She stormed off, furious with me. But I slept like a baby. You know why? Because I did the right thing. You know, a lot of us are scared about being sued now as physicians. And I always tell my residents and medical students, I said, don't ever think that way when you take care of patients. Because someone may sue you. You may lose. Now, I've never been sued, praise the Lord, but it's only a matter of time if I practice long enough. In our literature in emergency medicine, there's articles called "It's not if, it's when." Right? Especially, you know, with the recession, economy's like tanking, right? People losing their jobs for different reasons. Hey, you know, somebody died. Let's see if I can figure out a reason to pin it on the doc, right? People think that way, I'm telling you. And they'll have stuff reviewed by a lawyer just because their loved one died. But it's the emergency room. People die, right? I'm not Jesus. I can't raise them from the dead, you know? I mean, he could give me power to do that. So far, I haven't been able to. But I tell my students and residents, I say, listen, you might win or you might lose if someone sues you. But I'd rather lose on earth than face the judge in heaven. Can you imagine? I know a lot of physicians, they never ring their call light. You know why? Yeah, they don't want to be sued. Because the thing is that they're not earning any money for it, so why would they even take that risk? Why would they even do that? I've seen them let nurses struggle with the patient. Not to say a nurse is a bad person, but that nurse is not a physician. You got to help them. And can you imagine if I didn't ring my call light, I let the orthopedic surgeon try to take care of her? I would stand before the Lord and he'd say, why did you let my daughter die? You were the absolute highest person for this sort of situation and you did nothing. But what was very interesting is that she was not grateful, right? She wanted me to butt out. She wasn't willing to give up a little inconvenience for the other passengers on the flight that, I mean, she could have died and, you know, maybe those passengers, they'd have to turn around or something like that. She was not focused on them. She was focused on, I need to be at this meeting. And I'm like, but you need to arrive alive, right? So what are the types of diabetes? Shoot out some types of diabetes. Type 2, what's type 2? Adult onset. You know, it's interesting, we don't use that name anymore. You know why? When I was in the emergency room, true story, I pick up the chart and I always read the chief complaint. It says ear pain. 6-year-old female, ear pain. So is that going to be complicated? No, right? I walked in the room, and as the nurse was walking out, I said, I want a blood sugar on this patient. She's like, on the 6-year-old? And I'm like, yeah. For ear pain. Her sugar was over 200 because her weight was almost 200. She was 180 pounds. She almost weighed as much as I do. At 6, yes. And I'm telling you right now, that's not the child's problem. You know what I mean? But this child had diabetes because if your random blood sugar is over 200, that's diabetes until you prove that it's not. But what type did she have? Adult onset. But was she an adult? No. But she had insulin resistance, right? Her type of diabetes was not the same as type 1, which is what? What's the type? What's the problem in type 1? What happens there? Your beta cells don't produce any insulin, and the theory is that there's an autoimmune sort of response, like maybe it's from cow milk exposure. There's a lot of people who say that, but the beta cells are somehow either killed or damaged or stunned. That's actually a new theory now, and that's why we can actually reverse about 1% of type 1 diabetics. Did you know that? Like 10, I'd say more 10%, not really 1. I'll give a little bit more hope, because that's what my experience was during my internship, during my college experience when I took care of people at a lifestyle center. We got about 10% of those people off all insulin. So do they have diabetes? They probably still do, because they got off all insulin, but these people were like running like 9 miles a day. Like they'd eat and then go for a run. Like not vigorous, right, but substantial. And then they'd eat lunch and then go for a run. And then eat supper and then go for a run, right? Did you know if you just walk a very brief time, like 5 minutes or so, 5-10 minutes, right after every meal, it's the equivalent power of glycemic control of a 45-minute moderate walk? Did you know that? That's why the new trend is now you got to take a walk after every meal. I don't know if you've heard your doctor start to recommend that. Anyone's doctor recommend that? They're behind, right? They're not keeping up with the literature. Because the thing is that when you take in that big meal, right, you don't want the spike of insulin, right? And what's going to prevent that spike? Burning it, right? So if you take a walk and you start to burn it, you have much better glycemic control because the sugar is trying to come up and your body's trying to burn it, right? So it'll do this, kind of blunt it, right? It's still going to go up, but it's not going to go up as high if you just ate, and then, I forgot to walk today. Let me walk in the evening, right? You're going to have to walk 45 minutes to get the same control of just a short 5-10 minute walk after every meal. You must do that as a diabetic. You're going to get better glycemic control, you're going to have less use of your meds, you're going to have less sliding scale need, but your doctor needs to know that stuff. He or she needs to keep up on that. But the thing is, most of us are just trained to just keep increasing the meds on you, right? We don't give you the hope of the way out. What other types of diabetes are there? Type 1, type 2, what else? Gestational, sure. And what is gestational like? What is it most like? What type of diabetes? Yeah, especially when you look at the fact that a woman with gestational diabetes, she's actually at risk, even after her pregnancy, of getting what? Type 2 diabetes. So if you got gestational diabetes, that's a beacon of warning for you. That means you have the predisposed genetic material to set you up. And you've got to be very aggressive. Like even when you checked your sugar, right? What do people say your sugar should be less than? Like what are we shooting for? 110, 90, 90 to 120. Of course Magdalena knows. Because if you're fasting sugar, I told you not to answer, Magdalena. So she could be giving the lecture, but just since I have the MD and the whatever graduate degree, they have me do it, right? She could probably do it. So the thing is if your sugar is now over 100, did you know it's flagged as high on lab tests now? And that's because they've shown that pre-diabetes can still do damage. If your sugar hangs out at 100 something, it's doing damage. Even though it's less than the 126, which is kind of the holy grail number, fasting 126, they're doing away with that now. They do not want your sugar high anymore. Have you ever noticed you go to Walmart, you take your blood pressure? Anyone ever do that? Like Walgreens, whatever. Take your blood pressure. It's always high, isn't it? Have you ever noticed that? Your blood pressure? Doesn't it give you like a flag? Like if it's over 120, or if the bottom number is over 80, did you know it's flagged as high now? Because they've shown that increases your risk for stroke and heart attack and stuff like that. You've got to have under 120 and under 80. That's like serious stuff. Same thing with glycemic control now. They found that if your fasting sugar is somewhere between 95 and 100, you have both the genes for diabetes. If it's somewhere between 90 and 95, no matter how healthy you are, you have one of the genes. So be very, very careful to understand what is normal and what is optimal, right? There's a total difference between normal and optimal, right? Normal is like cholesterol, right? What's a normal cholesterol? Does anyone know what normal cholesterol is? Less than what? I told you not to answer. Less than 200, right? But she's right. When you look at the Framingham studies, which are long prospective trials, like the Framingham studies are still going on. They started off in like the 40s, 50s, all this stuff, right? And they've been going on, and they found that during their trials, nobody with a cholesterol of 140 ever had a cardiac event. So what should your cholesterol be? Around 140, right? If you want to never have a heart attack, people say, well, that's not possible. I'm like, well, my cholesterol is 140. So it's not impossible, right? It's not impossible. What are the types of diabetes? Type 1, type 2, what else? Gestational, we talked about that. Juvenile is type 1. What else? Here's a bonus, are you ready? If someone can tell me what diabetes type 3 is and tell me the mechanism of action, I will give you $100 right now. But not you, yes, obviously. I said that at the beginning, but you keep answering, Magdalena. I love you. Anyone can do it? It's related, but I want the diagnosis and I want the mechanism of how it works. It's Alzheimer's. They believe that type 3 diabetes, you almost got the $100. I'll give you a...
She said Alzheimer's.
Okay, give me the mechanism. I'll give you half credit. I'll give you a $100 smile. How about that? So, yes, it is Alzheimer's. I'll give you credit for that. But I wanted the mechanism. Did I not say that too? Yeah, but she already gave you the hint. Hey, give me the mechanism.
I thought it was that the sugar damages the arterial and the capillaries, and then it cuts.
Insulin is atherogenic, but it's actually the same mechanism as type 2. Okay. There's insulin resistance in the liver and the muscles, but also insulin resistance in the brain. So the cell is starving, but it can't get the sugar in, right? Can't get the sugar in. That's why there's been recent pilot studies. They've taken these nursing home residents who are like, whatever, they can't even talk. Instead of putting butter on their bread, they put coconut oil. Have you seen those studies? And some of those people wake up and they start talking. The reason why is coconut oil has shorter chain fatty acids that can go in the cell by diffusion without insulin. Doesn't need insulin. And so now the cell can burn some of those fatty acids, the myristic and the lauric acid, right, that are shorter chain. That's okay. I'll give you another chance, all right? I noted that you were close. You were close. I'm not going to give away $100 that easily, though. So I'm poor. I work as a physician, but only like this month, I only work like 2 days. So people say, what do you do the rest of the time? This stuff. That's what I do. I was in Arizona for GYC at the beginning of this month. I've got you guys. I got New Zealand coming up on the 15th. So I give most of my time away. So any other types of diabetes? I'll give you another chance. If you can name 2 more types of diabetes without looking at your phone, I'll give you the $100. And describe the mechanism. Has anyone ever heard of bronze diabetes? Anyone ever heard of bronze diabetes? It's when iron infiltrates your liver and it doesn't function. Anyone heard of diabetes insipidus? Anyone heard of that? That's usually due to head injury or sodium abnormalities. Basically, it's an issue in your brain. It's related to antidiuretic hormone, which normally kicks in when you go to sleep so you don't pee all night, right? But it makes your urine very dilute. And because of the dilution of the urine, right, you can have problems with sugar metabolism. So normally, if you have the antidiuretic hormone, if it's turned up too high, then it kind of concentrates the sugar and stuff like that. But it's basically an issue in your head. But for all practical purposes, don't worry about any of those. Just worry about type 1, type 2, gestational. Those are the common ones. But the main one of all of them, what's the main one? Like the most common one of all of them by a landslide. Type 2, right? That's what most of us have. So that's what I'm going to focus in on. That's why I said 95% of diabetes and not all of diabetes, right? Type 1, if all your beta cells are wiped out, you don't produce any insulin. And if you don't produce any insulin, then it's going to be really tough to control your sugar. I mean, you're going to have to be like an ultra marathoner to try to do that, which is going to be tough. But if we catch you early in the honeymoon phase, have you heard of that? The honeymoon phase of type 1 diabetes, we can reverse it. About 10% of the time. So what are some symptoms of people with diabetes? How do they know they have diabetes? They're thirsty, but that's which type of diabetes generally? It's more type 1, right? Polyuria, polydipsia, polyphagia, just fancy words for a lot of pee, a lot of thirst, a lot of eating, right? It's like that person who's type 1, they're really skinny, right? And the type 2 person is generally what? Well, they're generally not tired, but what do they look like? Well, we can't even say that. Did you know that I actually saw a post that says, I resent that term. No one should be using that term anymore. Have you seen that? Should not call anyone obese. You shouldn't use that terminology at all. You know, even when I was practicing medicine like 2 decades ago, I had nurses that didn't want to use that term anymore. Because whenever I type up the discharge instructions, I have to put a diagnosis, right? And I'll say tobacco dependence, alcoholism, obesity, diabetes, whatever. I'll type all of those. They asked me, they came over and asked me, they said, can you remove obesity from the diagnosis? I said, why? They said, because we've got to read all that stuff to the patient by law. When you put a diagnosis, we've got to read, well, they've got to lose weight, they've got to do this. And I'm like, but that's what I want you to do. They said, well, everyone's just so offended. I mean, we're getting complaints. I'm serious. This is where we're at. That was where we were at 20 years ago. Where do you think we're at now? Like, can you imagine if I type morbid obesity? People probably aren't very happy, but people aren't just morbidly obese. They're like, there's a new term now called uncontrolled obesity. Did you know that? That girl that was 6 years old, she wasn't just morbidly obese, she was uncontrolled obesity. I think her BMI was greater than 60. I mean, that's some serious stuff. But you can't tell the truth to people anymore because they can't handle the truth. I've been wanting to say that for a long time. No, I'm just kidding. But, I mean, I think we need to be honest with people. Yes, you need to treat somebody, but you need to tell them why they have this problem. Because if you're not honest, right, you're just playing a game with your patients. And I don't think that's fair for anyone. But what's interesting is many times type 2 diabetics have no symptoms. Did you know that? Sometimes they'll say, I know my sugar's off because my vision's blurry. Have you ever heard someone say that? That's because the sugar goes into their lens and it swells and it can't contract and change shape. Sometimes people have problems with fatigue, but sometimes they don't. You know, you don't necessarily have to have any symptoms. You could have diabetes right now, right? And that might not be revealed by just a random sugar. You might need a hemoglobin A1C. Anyone heard of that? Or you might need a glucose tolerance test. Not everybody is going to flag positive at their doctor. Just like people, like your blood pressure. That's why I tell people, check it at Walgreens, check it at wherever, you know? Because it's like, there's some people who have white coat, high blood pressure, like they get scared and it's high, but there's some people who are just more relaxed. But then, when they're at home, you know, fighting with their kids, you know, their blood pressure might go up, right? In one study, this is about 10 years ago, but I think it's pretty scary still. 90% of people with type 2 diabetes had undiagnosed kidney damage. Did you know that? That's serious. You need your kidneys. You don't want to go on dialysis. Once you go on dialysis, there's almost no one that comes off. There's only one physician I've ever met in my life who's told me I've gotten 2 patients off dialysis. There's one person who I've known. That's Dr. Supit, but he's in Guam, so you probably can't get a hold of him. What's the number one cause of death for a diabetic? Yes, heart attack. She knew. If you are diabetic, you're 10 times more likely to have a heart attack. Did you know that? If you're a smoker, you're only 7 times likely to have lung cancer. Did you know that? So it's actually worse to be a diabetic for heart disease. But it doesn't just cause death. What are some common complications of diabetes? For example, what's the number one cause of blindness? Glaucoma, it's not. It's between 2. Worldwide, yes, maybe like river blindness or glaucoma, but it's either diabetes or hypertensive retinopathy, one of those 2. Macular degeneration kind of is up there too. Some people say it might be number 1, but diabetes up there. Number 1 cause of amputation or peripheral vascular disease. So one of the 2. Well, number 1 cause of anything else? True story. I was in med school. All of the patients were contacted and they wanted a recall of this medication. It was a blood pressure medication. They said, let's scrap it, let's cut our losses, because the problem was it was really high and the pressure was really low and then really high. Again, it wasn't like a steady state sort of drug. It had kind of a short half-life. They didn't like it. So they're going to scrap it. So they went to get the drugs back from everyone on the recall, but nobody returned their calls. Everyone would ghost them, like totally ignore them. And then finally they had to send their reps to people's doors, and they're like, we know you're in there, it's okay, just tell us why you're not giving us back the drugs. And they finally came to the door and they're like, here's why. So they took the drug from the cardiologist and put it in a different department. And my friends, medical students, residents, attendings, they liquidated their 401ks. They took the penalty. They mortgaged out their houses or sold everything. They borrowed as much money as they possibly could. And you can borrow a lot as a physician because you're viewed as a good risk because they figure you'll always have a job. That's not always true. Some of my friends were fired actually 2 or 3 years ago as physicians. So you not necessarily always have a job. But they basically maxed out their debt ratio like 700, like crazy amounts of debt. And they put all of their money into Pfizer. Why did they do that? It was Viagra. That was the blood pressure medication. And in 1 month, they didn't double their money, triple it, quadruple it. They made 7 times their money in 30 days. Because they had the ultimate insider training. And that's what I'm going to give you this weekend. I'm going to give you the ultimate insider training on how to reverse your diabetes. So, what if you're perfect at controlling your diabetes? You're going to live a long, healthy life, right? Did you know you still lose 10 years off your life? Because there's a difference between controlling your diabetes and reversing your diabetes. That's what we want to do, is we want to reverse it. But is that possible? Let's take a look. Some people said that the cause of diabetes was carbs, right? Old study. James Anderson, many decades ago, actually before I was born, he did this study. And he gave healthy volunteers a pound of white sugar every day. That's a lot of sugar. But did you know that 1 can of soda has 12 teaspoons of sugar? How do you fit all that in the can of sugar? The can of soda, I mean, how do you, dissolve somehow or whatever, right? And they found that none of these guys got diabetes. Then he placed them on a 60% fat diet, corn oil. All of them had diabetes in 2 weeks. Did you know that? At least by the urine test or the glucose tolerance test, hemoglobin A1C, whatever they use, What does stress do to your blood sugar? It goes up. There was one lady. This is not a joke. This is a true story, okay? And she was a patient of several of my colleagues. I think she actually saw Dr. Youngberg. And nothing they did worked. They put her on chromium. They put her on all this stuff. She was working out. She was walking like 5 miles a day. She was vegan. She's all this stuff. And it turns out that she had a major childhood trauma. And it wasn't until they resolved that. Once they resolved it, all her diabetes went away. Did you know that? It was amazing. She had been abused. And that was the thing, is that it didn't matter what they did or how much they did. It didn't go away. Sometimes it's not what you're eating, but it's what's eating you, right? So, what do they use for gestational diabetes? What's the treatment for that? What do they give for these ladies? No, you can't use metformin in pregnancy. Insulin, right? Yeah. So they give them insulin. Now, why are they giving them insulin? Yeah, what happens if they don't treat it? What happens if they don't manage it? What happens to the baby? Yeah, gigantic. I've seen 15-pound babies. One was almost 20 pounds. Because the baby's seeing all those hormones, right? Just because you're insulin resistant doesn't mean that the baby's insulin resistant. Does that make sense? You may be insulin resistant, but that baby is like, right? Because insulin is what type of hormone? It's a growth hormone, right? Now, that's going to be important in just a few slides. Keep that in mind, okay? Very important. So, insulin is atherogenic. Did you know that? It encourages the plaque to lay down on the arteries. What was the most common cause of death in diabetes? Wow, that doesn't sound like a good idea, does it? Ooh, right? If I have my glasses, right? I'm nearsighted. Am I no longer nearsighted? Have I cured it? I'm just managing the symptom, right? And remember, that is what all of medicine does, pretty much. But people will say, well, yeah, but you got to manage symptoms, and I agree with that. But that's what our entire culture does. Did you know that? All of us. Right? I'm working on a program right now to reverse age. Don't worry, I'm not going to talk about that. I won't go off topic. All you're going to ask me about it, though, I already know. But so what I'm doing is I am challenging traditional wisdom, and I'm trying to apply it to myself, and it's working. I see my gray hairs turning black. I have more lean mass. I'm stronger. I actually had my last wrinkle go away just recently. I had like this big wrinkle right under here. It just went away. I'm 48 years old. Did you know that? 48, no meds, no medical problems. That can be you. I have gray hairs, but not many. I work out with guys that are 19, 21, 18, and 25. And I can keep up with them. I can do, how many people here can do a pull-up? Can do a pull-up? How many can you do, like, total? I can do 4 sets of 8, and I weigh 215 pounds. Anyone here do that? Yeah. It's hard to do a pull-up when you're tall. I'm 6'1". It's hard. Because from a physics standpoint, if your arms are longer, there's more torque on the lever, right? It's hard. Like these guys that are like 5'5", they're just benching like this. They're just moving the bar like this. I got to go, right? It's hard when you got longer limbs and you're a tall guy, right? But let me tell you, before I started this, I couldn't even do like 1 pull-up. Maybe 1, 2. If I would had $1 million waiting up there at the top for me, I could have done maybe 3, I don't know. But it's really working. And one of the very simple things, I'll give you a little hint. I'm going to give you one little taste of the age reversal program. Think about what we do in life, right? We're always trying to cover the symptom. Did you know that? When our hair goes gray, what do?
Cover it.
Yeah, right? And did you know that dye is toxic to you? Did you? Okay, I guess you could. You could get a job as Mr. Clean or something like that, right? I mean, you could actually make some money off that. But anyway, did you know that hair dye is toxic? Did you know that your scalp is one of the most absorptive sites of your body? Did you know we can give you a medication, just put it on your skin, you can absorb it transdermally? Did you know hormones can be absorbed, just like a little patch on you? Like a cream? You should never put anything on your scalp that you're not willing to eat. That's what I tell people. You're like, I patented that phrase. Is that what you're saying?
No, we just do, I'm phasing to clean.
Yeah. So here's the thing. Have you ever heard of drug-resistant bacteria, like antibiotic-resistant bacteria? Right? And people are like, well, how did this all get here? But what's in your soap? What's in your cleansers? Antibiotics. What's in your deodorant? Antibiotics. Is it a mystery that we have drug-resistant MRSA? Right? Instead of putting the deodorant on, you should ask yourself, why do I stink? Have you thought about that? That's like a novel idea. Nobody even knows that. You know, when I went on this program, I no longer need deodorant. Don't worry. It's all right. I don't stink. Lemon juice. I'm not using lemon juice, but that's good. But the thing is I actually don't use deodorant on purpose, because when I stink, then what do I need to do? I need to change something. Not necessarily water. I need to change something. And I know what to change.
First your shirt.
Dun-ching. I change my shirt every day. Thank you very much. Right? But that's what I'm saying, is that in medicine, we're managing the blood sugar. But if you manage the blood sugar with insulin and you're giving the person like atherosclerosis and they die of a heart attack, I mean, do you think that's a good idea? I hope not. Name an oral pill for diabetes. Name some pills. You name metformin, name another one. Sure, glipizide, glyburide, right? Those are all sulfonylureas. Did you know those sulfonylureas stimulate the pancreas to produce more insulin? So the problem is, if you have too much on board, what can happen? You can have low blood sugar, right? Did you know you can die from sulfonylurea overdose? Because the half-life is 18 hours. That's the easiest admit in the ER ever. Hey doc, this guy came in, his blood sugar was 20, we gave him an AMPA D50, can we let him go? I'll always say, are they on anything for diabetes? I don't know, he's on some pills. I'm like, can you tell me what the pills are? I'm not sure, bring him in. And I can just admit the person. I don't even have to do a workup. I call the hospitalist and say, I got a guy, had hypoglycemia, he's on glyburide. And they don't even ask for a lab test. They're like, okay. Because they know what's going to happen to that sugar after the squirt of sugar they gave them. It's going to drop again, right? So I'll give them the sugar, I'll feed them a full meal, but I'll admit them, right? Because you don't want to send them home, because what if their sugar bottoms out when they're asleep? They die, right? Or something serious is going to happen, like a seizure or whatever, right? Serious stuff. Now, what's very interesting is that all sulfonylureas have a black box warning. What does black box mean? What does that mean? If something has a black box warning on it, what does that mean? Well, not good means death. It basically means it's associated with some form of death. It says that sulfonylureas significantly increase the risk of fatal heart attack. All of them. Now remind me again the number one cause of death. Do you think that's a good idea? And I'm not saying you shouldn't take your metformin, you shouldn't take your sulfonylureas. You know, metformin, did you know that can cause fulminant liver failure? That can cause lactic acidosis? Did you know that that can actually damage your liver? And I'm not saying it does for everybody, but has anyone ever gotten a CT scan before? CAT scan? Have you gotten it with contrast? Do you know there's a little sheet that they fill out, and they say, if you are on metformin, do you know what that says? You can't take it for like 3 days. Do you know why? Well, it's nephrotoxic also, because the dye is excreted by your kidneys, right? And it can't handle both toxins, right? So, what's the real answer to cure diabetes? Has anyone ever said, hey, my doc increased my medicine and my diabetes is cured? Have they ever said that? And they never will. Did you know that? The medical establishment does not make any money off you when you're healthy. Did you know that? They hate people like me on no meds, no medical problems, right? They hate that. The only people who like me would be people like insurance companies, because I'm paying, right? But I'm not utilizing. But the healthcare industry hates it, right? They don't make any money off you if you're healthy or if you're dead. So what do you think their goal is? Keep you sick. Now, I'm not saying that's their goal, but I'm just saying that's the most lucrative form. That's why nobody makes any antibiotics now. They make anti-cholesterol medicines. They create anti-hypertensive medications. Why? How long are you going to be on those? Your whole life. That's how they get you, right? Didn't your dad always used to say that? That's how they get you, right? And that's the thing, is that I don't want you to be on any meds at all. That's why I'm here, right? Christ in John chapter 10, verse 10. Does anyone know what that says? Besides Magdalena, yes. I am come that they might have what? And that they might have it what? Do you think being on 17 different meds is abundant life? But I see patients on that many meds every day at my job. Did you know that? Every single day. I got to give them a medication to counteract the side effect from the other medication. Did you know that? Does that seem like a good idea? Of course not. I don't make any money off doing stuff like this, but I believe that I can help people have that abundant life. That's what I do. There is a better way, and it was done at the University of Babylon, on the plains of Dura, in the oldest controlled trial known to man. The control group, the others. The experimental group, Daniel, Hananiah, Mishael, and Azariah, better known as Shadrach, Meshach, and Abednego, and Belteshazzar. That was Daniel, right? You know, that was a Jeopardy question. They wanted to know what the Hebrew names of the three worthies were. Nobody got it. Nobody reads the Bible anymore. They gave all these weird names. I was waiting for them to say like Larry, Shemp, and Mo or something like that. They got these names like way off base. It wasn't even close. It was weird. Was it Joseph, Daniel, and Noah? And they still got that wrong, because that's not the three Hebrew worthies. Daniel was not there, remember? He was on some ambassador trip or whatever, right? But he would have resisted too, I believe, right? So here's the trial. How long was the trial? Do you remember? 10 days, right? Prove your servants 10 days and give us what to eat? Give me pulse, Melzar, right? I said that in honor of Danner Vieira, one of my mentors who passed away. He would always say that in his presentation of Daniel chapter 1. He'd say, give me pulse, Melzar. What's pulse, right? It's a plant-based diet. And what did he drink? Interesting. And what were the results? Do you think that changing your lifestyle for 10 days can make a difference? Do you think if you did everything that we told you to do this weekend in 10 days, you would be different? Do you think? What I'm going to tell you right now is going to blow your mind. Whether you believe it or don't, you're right. Think about that. Whether you believe me or you don't, you're right. You know why? Because if you believe that you can change, you're going to do this stuff. If you believe that you can't change and it won't matter, what are you going to do? One of my favorite trainers, he says, if nothing changes, then nothing changes. I know that seems very simplistic, but it's true, right? If you don't change your sets, if you don't change your reps, if you don't change your diet, if you don't change your sleep, nothing's changing in the gym, right? That's not going to work. And they were healthier than everybody else. Now, what's very interesting, what religion was Daniel? He was a good Jewish boy. Bless you. Could he not have said, "Give me kosher, Melzar"? Could he not have said that? Yes or no? Yes or no? Sure, he could have, right? But he didn't. Could he have said, "Give me lacto-ovo, Melzar"? Could he? Yes or no? Sure, he could have. But he didn't. And a lot of my colleagues, even in this church, how many of you are Seventh-day Adventists? Raise your hand. Say, so not everybody, but almost everybody. If you're not baptized, no, just kidding. We'll still count you, but you should be baptized. Many of the people even in our church, they said, I eat clean meats. You know? I don't know why you're being legalistic. It's not about being legalistic. It's not about legalism, right? It has nothing to do with that. I am not vegan because I'm legalistic, okay? I just want you to know that, right? Before this talk, I was in the back, and what was I doing?
Eating.
Yeah. Do you know what I was eating?
Plants.
Yes, I did. I had brown rice. I had seitan, not Satan, right? Seitan. I had arugula and seaweed. Oh, you have a good memory. In that meal, I was missing one nutrient. Does anyone know what it is? If someone can tell me the specific nutrient I was missing in that meal, actually, I'll say, if someone can tell me the... No, I'll just say, I'm not going to put any money on it. I know everyone's going to go crazy. But if someone can tell me the nutrient that I was missing in that meal, I will be very impressed. It's a micronutrient. I'll give you a hint. Anyone know? What? No, go ahead.
I was thinking selenium, but I was also thinking lysine, but that's an amino acid.
There might be a little selenium in there. But there's one that most people would probably say. Because see, that was really good. That was actually absolutely true. Definitely no D. What else? What is missing in a vegan diet of what I just ate?
B12.
That's not true. Did you know that seaweed, I just ate 160% of the RDA requirement for B12 because I had seaweed. How many people knew that B12 was in seaweed? Of course, Magdalena, right? Yeah. I ate 2 sheets of nori, which gave me 3.9 micrograms of vitamin B12, which is 160% of what I need for the day. Did you know that? Dun, 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 right? So, eat your sushi. Vegan sushi, right? None of that raw fish stuff. But my point is, why did Daniel choose vegan. He didn't have to. He could eat clean meats. Could he not have? Sure. Could he have eaten lacto-ovo? Could he have been pescatarian? I mean, people do all kinds of stuff, right? Why would he go vegan? What do you think? Where did he get that idea from?
Those things weren't offered to idols.
Ah, interesting.
And the wine was offered before his God.
I like that. No, that's true, right? So the wine and the meats were probably offered to idols. That's probably true. Well, he could have said, give me Oreos, Melzar. Did you know Oreos are vegan? He could have said, give me potato chips, Melzar. Potato chips are vegan. Give me soda, Melzar. Do you know soda is vegan? And there are people like that in our church too. I've been vegetarian for 60 years. I'm like, yeah, but you're like really overweight, so there's a problem. But I wouldn't say that to people. Like, I don't say that. I say, oh, okay, tell me about that. How's that working for you? You know? So that's the point. Why did Daniel, where did he get the idea of going vegan? Yeah, exactly. He knew what the original design was for man, and he also knew that Melzar wasn't going to wait around for 3 months. Does that make sense? He even said, listen, the king will have my head if you're not in good shape. So you better like chop, chop, wiki, wiki with this little thing you're doing, right? I better see some fire, you know? And when did they see a difference? 10 days, right? And it was in comparison with his control group, which were the other captives, right? Same genetically, right? What happened at the end of 3 years? Do you remember? They were 10 times better. Now I'm going to ask you this question. Does your boss come up to you and say, you know, I wish I had 10 of you. You're like worth 10 of my workers. Do they say, you are 10 times better than any speaker or any doctor I've ever talked to? Do they say that? Do you know why they don't? Because you're not doing it right. I'm just saying. I'm not trying to be mean, right? It's more than just diet. That's what I'm trying to say. Daniel did more than just eat differently, right? His physical life was different, but was his spiritual life different? Yes, it was, right? So it's more than just what you eat. So here's the thing. Why does Jesus say in John chapter 5, verse 6, do you want to get well? Isn't that a funny sort of thing? Who was he speaking to? Do you remember who he was talking to in John chapter 5? Where was he? Do you know that Bethesda is B the SDA? I'm just telling you. I'm just saying. It is, right? I believe this is important. It's B the SDA. It is. I'm just saying. It is B the SDA. So why does Jesus ask such a silly question? I mean, the guy's like, I'm not here to get a suntan. I'm here to get healed, right? Doesn't that seem like a funny question? Why do you suppose Jesus asked that? Exactly. That's the thing. Jesus has to get consent. God does not force you. Anything that's trying to force you or threaten you or bribe you or coerce you or threaten you or shame you is the enemy. That is not the way God works. He just asks you, do you want me to help you? I mean, it seems obvious, right? But God must have your permission. Did you know that? He's a gentleman. He's not going to force you, even something good, right? People may say, well, but this is for your own good. That's why we should force you. Does God give you something for your own good? Did he force this guy? No, he asked him, right? God does not even force things that are for your own good. Did you know that? That's not how God rolls. So if someone's trying to tell you, this is for your own good, this is for the good of society, this is why you have to do this, that's the devil. I'm just telling you that right now. That is the devil talking to you. Now, they may not realize that they're talking for the devil, but that's not how God rolls. And that's not how any physician should roll. My job is not to tell you what to do. My job is to give you the options. Did you know that? And then you decide what you want to do, right? If you want to quit smoking, great. If you don't, that's up to you, right? I can't make you, right? I had one of my patients come to me, "Doc, you've finally gotten through to me." I said, "Oh, did you quit smoking?" "No, I only smoke organic. And I roll my own. So you don't have to worry about me anymore, Doc." Well, it's a start, right? Alcohol's vegan too, I guess, I suppose. One of my chefs for my mom, my grandma actually, she was wheelchair bound, had a big stroke. And one of my chefs, he was diabetic. So he went to go give himself a shot. I said, "What are you doing?" He's like, "I'm doing my sliding scale." I'm like, "Don't do that." He's like, "Are you telling me not to take my medicine?" I said, "No, I'm not saying that. Don't do that right now." He's like, "What am I going to do?" I said, "Take grandma for a walk." "Well, I got to make lunch." I said, "I'll make lunch. Just go." "Well, what am I going to do?" I said, "Take this liter of water, go push her up and down the hills." So he went and he pushed her up and down the hills for an hour and drank that liter of water. And I said, "Now check your sugar again." What do you think it was? It wasn't normal, but it was less, right? In this case, the first time I think it was normal, but not always. And I said, from now on, every time you need to cover yourself with your sliding scale, I want you to walk for an hour, drink a liter of water. In 5 months, he was off all meds. And he'd only lost 20 pounds. He didn't lose much. He was off all meds to the point where his doctor said, "What are you doing? And I need to figure out this program." He's like, "Well, I just go for a walk. I drink water." And she's like, "And?" "Oh, that's all I do. That's what the doctor said." Yeah, ooh. But what he wasn't telling her is he was eating all of our food too, right? And I fed grandma pretty much vegan plus wild-caught Alaska salmon. I'm not saying that you should do that. But she was like thin. She was like 5'8". She weighed like 110. So she needed the calories, right? Most of us do not. But that was the thing, is when he left us and was no longer taking care of grandma, do you know what happened? It all came back. Yep. He gained his weight back and all the meds came right back. Now why? Well, he wasn't doing the same thing, right? It's not rocket science. They've looked at the American Diabetic Association diet versus a vegan diet. And what was nice in this trial, they didn't give you the foods. Like I've heard people say, "I can be vegan if somebody makes me 3 meals a day." I could be raw vegan if you're going to make me the meal, right? Then I just give you like a carrot or something like that. You're like, "No, that's not what I mean," right? They want like a restaurant grade sort of vegan meal, right? But that has a lot more fat and a lot more salt in it, right? I mean, it's better for you, but it's probably not ideal. So what they found was the vegan group, almost half of them reduced their meds versus only a quarter of the ADA group. The vegan group lost 14 pounds. The ADA group lost 6. LDL cholesterol, this is what I'm most excited about. 21% reduction. What does that mean? Why is that a big deal in someone with diabetes? This reduces your risk of heart disease by 63%. Did you know that? That's gigantic. Losing 21% of your LDL is like a miracle, basically. And you didn't have to portion control. That's so annoying, right? With a lot of these diets, you got to eat this, you got to measure this, right? Nobody got time for that, right? Do you know I tell my diabetic patients that don't believe that carbs, a lot of them believe that carbs are bad for them, right? I say, to prove you, I'm going to get you off your meds with fruit. And they're like, "No, that's impossible." No, I said, "No, it's possible." I said, "Eat apples for 3 days." "What do you mean?" "Go out, buy a bag of 30 organic apples or get them from a tree and eat 4 for breakfast, 4 for lunch, 2 for supper." You know what happens at the end of those 3 days? I had a guy, his blood sugar was 450. He was on his 3rd round of antibiotics for cellulitis. And I noticed that his legs were like starting to form a little fluctuance. I said, "You're probably going to form abscesses there." He's like, "I don't want surgery." And I said, "Well, what do you want to do?" He's like, "I'm willing to do anything." I said, "Eat apples for 3 days." His sugar was over 450 at the end of 3 days. Do you know what it was? It wasn't normal, but it was like 200s. I mean, that's reasonable. And the cellulitis went away with no antibiotics. Why? Because his immune system wasn't like drowning in sugar, right? Did you know your immune system is suppressed by diabetes? Serious stuff. So let's go back to our friend in the plane. She was not happy with me for helping her. Why? Well, she actually wanted something from the airline. And what I said to the airline caused them to not allow her to board. But why was she upset at me? Yeah. What would she rather have done? Do it on her own, right? She wants to do it on her own. She wants to take care of herself, right? She disagreed with my assessment, right? Are there people still like that today who maybe don't think they have a problem? Do you think she had a problem? Her pump was like probably out of control. It's probably, as soon as I let her go, it was probably still producing insulin, right? Probably malfunction. But did you know that that's what's wrong with us spiritually? Do you know that this church is called the church of what? Laodicea. It says, I am what? Rich and increased with goods and have need of. The person who feels they don't have a problem can never find the cure. Because you will never seek for a cure of what you don't recognize as an issue. And you'll never recognize something as an issue until you're honest with yourself and with those around you. And what I'm telling you today is God designs you to have life and to have it more abundantly. Are you enjoying that? Do you have abundant life? You're like, yes, there's no way I could be any happier. I'm going to tell you right now, there's a very interesting statement. And a lot of my friends think that this is a little, how would I say, it's a little too narrow-minded, right? But this is one of my favorite authors. And she says, when you're thinking about finding a woman, right? I was single till about a week ago. And I asked Ashley, she's a dietitian. She's good at reversing diabetes. I asked her to be my girlfriend. And she said yes. I was so excited. But this is an interesting criteria. My favorite author asked this question. Is Ashley, or the girl you're considering, this object of your affection in the scale of intelligence and moral excellence, in deportment and cultivated manners, such that you will feel a pride in presenting her to your father's family? I'm very proud of Ashley, by the way. To acknowledge her in all society as the object of your choice. No problem with that. One whose society, conversational powers, and manners will interest and satisfy your most grand expectations. That's a pretty tall bill, don't you think? Some people say, oh, that's not realistic. You're never going to find a woman like that. I found one like that. I can say that. I'm very, very happy. I have the grandest expectations, and she supersedes all of them. But that's how I want you to look at your health. Is your current health superseding your most grand expectations right now. I tell you right now, unless I'm Mr. Olympia or a triathlete or something like that, I'm not there yet. Unless I can win the Ironman, I'm not there yet. I'm not going to say I'm going to try to go after the Ironman. I don't really like the Ironman look. I think they look too thin. But anyway, but that's all I'm saying, is if your health right now is not satisfying your grandest expectations, come tomorrow night. Come tomorrow night. Come Saturday morning. If you feel like, there could be something more, we'll help you to find more. But if you're satisfied, I'm not going to make you do anything, right? I'm just here for free, right? They paid for my flight and other stuff, whatever. They're going to throw a couple shekels my way. I donate it away, so I don't profit off this. That's what I'm saying. But if you feel like there could be something more, I would encourage you. If there's anyone here right now who thinks, you know what, I think I can think of one way that my health could be improved. Is that true for any of you out here? So you think of one way your health can be improved. Now here's the second appeal. This is going to be harder. I can think of one way that my health could be improved, and I'm willing to change something so that it can be improved. If that's your decision, stand with me. There we go. Let's pray. Father in heaven, thank you so much for this precious young woman so many years ago that I was able to help. And I pray that you are with her wherever she is. And I pray that she would feel her need, that she doesn't feel like going it on her own, but she feels like doing something, Lord. She feels like change. She feels her need. And Lord, you've seen everyone here. We feel our need, Lord, and I just pray that we would feel our need not only of change, but that we would look to you for that change. That we can do so much here on earth. But I pray that you would give everyone the assurance that you are going to work supernaturally to help them reclaim their health. Because you've said in your word, beloved, I pray above all things that you would prosper and be in health. You want us to prosper and be in health, just as our soul prospers. And may this be true, we ask in Jesus' name. Amen. So come tomorrow for secrets to weight loss your doctor may not be telling you. Dun, dun, dun.